Well, we really have. As we'll take a look throughout the entire day, come a long way. But if we take a look specifically at Airway, without question, in the Judeo-Christian Bible, in the book of Genesis, who was the acknowledged master of airway management? And that was simply God. Very good. Now, y'all remember in Genesis chapter 1, what did God do to Adam? Y'all remember? He breathed life into Adam, and Adam became a living, breathing human being. Now, for those who work OB, you have to take a look at the book of Exodus, where it describes one of the first nurse midwives whose name was Puah. And Puah was credited with resuscitating a stillborn Hebrew male child. However, my personal favorite with the love of pediatrics comes from the book of 2 Kings, where it describes the story of the prophet Elisha. If you remember the story, Elisha was called to the house of a child who was dead. And Elisha leaned over the child, placed his mouth on the child's mouth, and much as with Adam, breathed life into the child. And the child sat up, sneezed 7 times, go figure, and proceeded to live. Well, if we look currently, believe it or not, there are people who might actually enjoy intubation. As you know, most people do not enjoy being intubated. It is not a pleasant occasion by any means, but in the event that we need to do it, let's talk about why. Well, head injuries and hyperventilation we'll talk about after we come back from break. Nobody's going to fault you for intubating a patient who's in full arrest. If they can't breathe or protect their airway, that's self-explanatory, but what exactly are social intubations? Otherwise known as, do you intubate people because they have a terminal case of winorrhea and they complain too much? Be honest? Absolutely. Number 2, does this child need to be intubated? Probably not. What very little known medical sign is this child showing you? Good. A positive you can sit up and bag yourself sign. Good. If you can sit up and manage your own airway, no matter what the numbers say, you are probably not in imminent danger of respiratory failure. So if we take a look at managing kids' airways now, it's just like managing a big person's airway. And that's you've only got 4 ways to do it. You can bag them. Or if you feel the need to, you can shove it down their nose, you can shove it down their mouth, or you can do one of the most intense procedures there is, and that's a crank. So first, let's talk about bagging. Now, what do y'all need to know about bagging? Number 1, does it work? Yeah, and actually y'all need to know how to bag for a couple reasons, because what are you going to do if they're not breathing before you tube them? Bag them. What do you do after you tube them? Bag them. What if you can't get them tubed? Bag them. Therefore, y'all need to know how to bag. Now, what's kind of interesting about bagging is called ACLS. If y'all have taken ACLS up until recently, it was best described as downright evil. That's all there was to it. It was awful. But there was 2 complaints from people across the country regarding ACLS. Number 1, the mega code. It was awful. It's still awful. But the other complaint, not from medics and not from RTs, because y'all did this every day, but from regular, especially ER or floor nurses, is called "You're making me intubate Annie." And nurses across the country said, I don't do anesthesia, I don't do transport, my hospital is never going to let me actually intubate a human. And they said, you're right, too bad, get over it, and intubate Annie. However, in the most recent guidelines, it's course dependent, but they actually now say you do not, as a rule, have to intubate Annie anymore. What y'all now have to do is demonstrate the ability to bag. Because studies by anesthesia have shown that if you have a tube sticking out of somebody's mouth, anybody can bag. Why? How hard is it? What do you do?
Squeeze.
Squish. Exactly. However, to put a bag and a mask on their face and make air go in and out, as a rule, people do an awful job. And the reason they do an awful job is people try to look like anesthesia. If you've ever seen anesthesia bag somebody, it looks effortless. Why? They hold it with one hand, they bag with the other. It's a beautiful thing. Why? They do it all day long. For everybody else, what they recommend is have one person put the mask on the face, the other one squish the bag, and hope and pray that air goes in and out. Now, the other reason y'all need to know how to bag is called paramedics. Now, as we'll show you throughout the day, all the studies that we're going to talk about, none of which are perfect. All of which have their flaws, but as a rule, the biggest thing it does is it made people think. In a very controversial study done in Los Angeles a couple years back, on Monday, Wednesday, and Friday, if you had a downright sick kid that needed to get intubated, paramedics intubated the kid. And on Tuesday, Thursday, and Saturday, if you had a downright sick kid that needed to get intubated, paramedics were told not to intubate the kid, but just to bag them and drive like heck for the ER. Who did better? The ones who just got bagged. Now, was it that the medics couldn't intubate? No, medics can intubate anything that moves. That is not the problem. But what they learned was a couple things. Number one, if you are dead, you cannot make them any worse. Therefore, take that out of the equation. However, if you are alive and you're going to get intubated, as we'll show you in a couple minutes, there's only two ways to do it, and that's called drugs or no drugs. And if you don't let pre-hospital or on the hospital side people give drugs, number one, your success rate is abysmal at best. And number two, bad things happen to your body. Your heart rate drops, your sat drops, your blood pressure goes all over the place, your brain pressure goes through the roof. Doing things without drugs is not pleasant. The other interesting thing they learned from this study, and this is LA, it's just like Chicago fire, it's about as busy as it's going to get. It's not rural, middle of nowhere America here. They found that having the chance of a street paramedic attempt to intubate a kid was only one time every 3 years. Think about it. Big people drop dead every day. That is not a problem. But when you're dealing with little kids, that's a completely different story. It's just not that often, especially in pre-hospital, that we need to intubate kids. And therefore, more and more people are saying, you know what, as a baseline, y'all need to know how to bag. Now, how is this getting a little easier? A couple options actually now exist. Number one, this is an LMA. An LMA is a laryngeal mask airway. Anesthesia has played with them for years now. Seemingly everyone else, namely emergency medicine and critical care, are now playing with them as well. The idea is this is not an endotracheal tube. This is blindly inserted. You merely open their mouth, you shove it down there, and it sits on top of the airway. The nice part is that when it's actually in there, it guides air into the trachea a lot nicer than just putting a bag and a mask in their face and allowing air to go all over the place. The big issue with an LMA is, number one, you got to make sure you secure it incredibly well, because to have it pop out is actually very easy. Number two, the other issue is called if you decide to barf. If you decide to barf, you know what? You're going to aspirate. That's all there is to it. This does not go through the cords. It does not offer the protection like an endotube does. But the nice part is that you barf a whole lot less with one of these things in than if you just merely bagged them. The other option, especially on the pre-hospital side in many parts of the country, is this. This is a combi tube. Combi tube, especially for adults, though they make one for smaller adults, which is appropriate for older children. But the idea is this is blindly inserted, which means if you cannot see anything, you just open their mouth and shove it down there, it's going to go somewhere. It's either going to go in the esophagus or it's going to go to the trachea. As we'll show you, only have two choices. Well, they actually have two balloons. One goes in the back of the throat, the other one goes in wherever else it went, and you inflate it. And it actually ventilates very nicely, whether it's in the trachea or the esophagus. Why this is a problem is this. In the realm of trauma, there's a medical phenomenon called B plus B plus B equals B. Y'all catch that? Very important. You won't see it in any textbook because I wrote it. It's called B plus B plus B equals B, which means Burger King plus beer plus bagging inevitably results in what? Barfing. Very good. Now, the problem is when y'all bag people, where does the air go? Good. Two places, actually. That's called the good spot and the bad spot. The good spot's called the trachea. The bad spot's called the esophagus. And how many trauma patients come in and PO? It just doesn't happen. Y'all know this. People go to Old Country Buffet before they wrap their car around a tree. Therefore, anesthesia will teach you the more you bag, the more they barf. Therefore, until you've got a tube in, bag them at your own risk. Now, to bag, you need two things, right? Number one, you need a bag. Number two, you need a mask. The part that people, as a rule, tend to forget is the mask. Now, when I first started doing transport 12 years ago, anesthesia taught me anywhere you go with anybody, bring a bag and a mask. They said you're taking a perfectly healthy, seemingly nothing wrong with you whatsoever, patient from the ER up to the floor, underneath the cart, throw a bag and a mask. Because what's the worst thing they're going to do in the elevator? Drop dead. And if they drop dead in the elevator and you don't have a bag and a mask, what are you stuck doing? Mouth to mouth. And as we'll show you later, that's downright gross and not recommended. Then they took it one step further. They said, all right, anywhere you go with anybody who is sick, meaning they've got a tube sticking out of their mouth, bring a bag and a mask. And their rationale is, what is the worst thing this person's going to do in the elevator? Good, sit up. Hand you their endotracheal tube and then what? Drop dead. And if you don't have a bag and a mask, what are you stuck doing? Mouth to mouth. And as we'll show you later, it's downright gross and not recommended. Therefore, anywhere you go with anybody, bring a bag and a mask. Now, when I first started doing transport, I thought I would be slick. And I used to tape masks to people's chests. Problem? Guys. Guys have big old pelts of chest hair across their chest, and you cannot tape anything to it that sticks. Therefore, a couple years back, an experienced Transport RT taught me something I now highly recommend. They said anywhere you go with anybody who's sick, meaning they've got a tube sticking out of their mouth, tape the mask to their forehead. Now, does it look incredibly tacky to have a mask taped to your forehead? Absolutely. But you know what? If you have a tube sticking out of your mouth, this is the least of your worries. Now, if you're sitting in the ER, if you're sitting in the pediatric ICU, please do not tape a mask to their forehead. They're not going anywhere. But anytime you're a paramedic rolling down the street, anytime you're going from the ER up to the PICU to X-ray, and they've got a tube, tape it to their forehead. Yes, it looks bad. But in the event that their tube falls out, you'll know where the mask is.